Within AHS, staff, physicians, and leaders use processes and procedures to enable them to care for patients. Carefully examining these processes to identify how they vary can help determine if you need to make system improvements. AHS leaders use various measures such as wait time and length of stay to better understand how a process is performing. Examining these measures using the appropriate graph, or what we like to call making meaning from evidence, can help you understand the variation that may exist to determine if quality, patient safety, or patient experience improvements need to take place. One way to examine variation in a process is to use a histogram. Histograms provide a snapshot of a process's performance for a specific period of time. It is a type of bar graph that draws attention to the distribution of the data and highlights which variable is most frequent. Histograms are used to recognize and analyze patterns to determine if the data follows a normal distribution curve, if your process is meeting organizational targets, if any changes have occurred from one period of time or another, or to compare processes. In thinking about process performance and measures, AHS has a 3-hour target for patients to be discharged from the emergency room if they do not require admission into an acute care bed. Let's say you want to measure your area's performance as it relates to this target. You would begin by collecting a sample of patient discharge times for a set time period. Then, you would examine this data by grouping the patient discharge times to see how they vary. Plotting this data into a histogram, a graph that visually displays the frequency of the data, you are able to see a snapshot of this process's performance, or how long it took for patients to be discharged from the ER. For a histogram, the variable is recorded on the horizontal or x-axis. In this case, the specific number of hours it took to discharge. Oftentimes, this axis displays data within bin ranges, such as 5 to 9. The frequency is recorded on the vertical or y-axis. Here the frequency is recorded by the number of discharged patients. A histogram also allows for easy comparison between a process's performance and the organizational target or specifications. Statistical values are also used to analyze this data further. Here you can see that the average number of hours it took to be discharged was 5.7. However, the value or discharge time that occurs most often in this dataset is 8 hours. This value is known as the mode, and it is important to note because it tells you a bit more about the actual discharge times not influenced by outliers, which are either very large or very small values in the dataset that are not typical. Another value to note is the median. This value tells you that 50% of the patients were seen either above or below the 6-hour mark, which is the true middle of the dataset and can be useful when using targets that have a percentage range. And lastly, you can see that patients waited between 1 and 9 hours to be discharged. This range between the variables is known as the spread, and it is imperative to note because the smaller the spread, the less variation that exists in the process. As you begin to analyze what is occurring, you want to consider, is this variation within the organizational targets, or is this something you're willing to accept? The answer to this will impact the decision if improvements need to be made. It's important to also examine the shape or pattern of your histogram. The pattern created by the data values helps to determine if a process is consistent and reliable. To do this, the shape is compared to the normal or bell curve. If your graph looks like this, then the data follows a normal distribution pattern, which generally means your process is consistent. But remember, a consistent process doesn't necessarily mean that it's meeting organizational targets or patient and family expectations. But if your histogram looks like this, or this, your process may have too much variation and/or be inconsistent. When the distribution patterns in a histogram forms these shapes, further investigation is often required to explore the reasons for the variation or to find out what makes that data unique to form that particular distribution. With regards to process improvement, other process assessment tools such as a process map can be used in conjunction with a histogram to explore this further. When examining a process within your area, It's important to note that inconsistent processes not only affect the process being analyzed, but can impact others connected to it. With this in mind, be sure to work with and explore how your process may affect other areas before moving ahead with your improvement effort. Here is a histogram you may encounter in your role. What can you conclude? What might you say about the spread of the data and the consistency of the process? Did you say the highest frequency of patients waited between 11 and 34 days from referral date to actual surgery, and the spread of the data shows patients waited between 12 and 261 days from referral to the actual surgery? As well, this process appears to be inconsistent, and further investigation should take place to understand the variation and if improvements need to take place. A histogram is a good tool to use when you want a snapshot of a process's performance at a specific point in time to examine the spread and consistency. It can be used in the Build Understanding step when using the AIW method for improvement, as well as the Act to Improve step to observe any improvements that may have taken place. In AHS, leaders may be able to access data for a specific area or project through a number of sources, such as RLS, FACT, Statit, and Tableau. If you require assistance using these or additional support to collect data for your project, AHS Clinical Quality Metrics is a great resource to support the design and development of measures and strategies and to help clinical teams obtain and use data to improve quality. Also, Process Improvement and Clinical Quality Improvement collaborates with staff, medical staff, and patients to improve clinical processes provincially and within each zone. All of these groups can be found on Insight. Thank you, and good luck making meaning from evidence.